Now, the Ghana AIDS Commission has commenced a door-to-door HIV and AIDS education and HIV testing. The door-to-door response or campaign and testing are part of strategies to get about 90% of people at risk to know their status, diagnosed and treated. At a capacity building workshop organized for a section of the Eastern and Volta Media in Ho, the Ghana AIDS Commission encouraged Ghanaians to know their status. The door-to-door campaign and testing is being piloted at the Ekuapem Rich, Kwewu, Krobo areas. And in the studio to explain further is Mr. Treme Etuahene, his head of research, monitoring and evaluation at the Ghana AIDS Commission. Good morning to you, sir. Thank you for your time.
Thank you, Emefa, for having me.
My name is Mama V.
Oh, sorry.
Yeah, that's fine. But let's explain to us why it's become necessary for you to now go door-to-door.
Right. Door-to-door HIV education and testing may sound new to Ghanaians, but it is not new. It's been one of the ways that for decades the Southern and Eastern African countries and also countries with high endemicity of HIV doing. And it's paid off for them. In Ghana, the prevalence is relatively low compared to such countries, and therefore we haven't used door-to-door until now. Now, we are having to use door-to-door because, as you said in your intro, we have committed in conjunction with the global community to achieve the HIV fast-track targets, which is 1990 by the year 2020. And the 1990 stands for, the first 90 says that by the year 2020, 90% of people living with HIV should know their HIV status. And we can only know, one can know his or her HIV status only when tested. And so we have to make testing available to Ghanaians. Now, so far, testing is more predominant among pregnant women because when they go to hospital, they are offered testing. And the majority of them, fortunately, accept to test for HIV. And that
but do we have pregnant women who refuse the testing?
Oh, yes, because it is not, as our policy says, people will have to voluntarily accept to test.
Yes.
But we have to offer the service to them.
But I thought for a pregnant woman, it's also about the child, the unborn child, and protection of that child.
Exactly. And so every woman, every mother is, cares for her child. And therefore, we want to do anything that will keep the child healthy and safe. And for this reason, most of them do accept to test.
But I was hoping to hear all pregnant women tests.
We will want to have 100%, acceptance of pregnant women testing. But it doesn't often, there are rare cases where some of them, opt out. And so we are encouraging every pregnant woman because it's good for themselves and for the child.
Shouldn't we begin to have a certain law that would make it compulsory? Because somebody should be protecting that child in the womb.
In health, it's not only HIV. In health, the principle of informed consent is very important. You cannot impose, any procedure on an individual because it's an aspect of human rights. And so the person, even when decides to opt out, we have a way of counseling and persuading until he or she accepts. But if having done any of all these, the person insists that he will not undergo testing, we do not force the person. But as I said, majority of pregnant women do usually accept to test. Now, the challenge we have is that uptake for HIV testing is quite low among men and other women. So we want to ensure that more and more men do test. And so we are encouraging, there are various, things we are doing to increase uptake of testing.
And I guess the door-to-door service is one of the strategies.
And the door-to-door service is one of the strategies.
Okay.
And so what that is intended to do is to bring the service to the doorsteps of the people. So in the community, they have the opportunity to know more about HIV, because we know that low uptake of HIV services is basically as a result of high level of stigma in the country. And so when we explain and teach them about HIV, we are able to address the misconceptions that they have about HIV and demystify HIV so that it is recognized as any other disease.
Okay.
That is what it is now, really.
But sure, not to cut you, but can you share the statistics with us, those living with HIV, and are the numbers rising?
Presently, we have almost 300,000 Ghanaians living with HIV across all ages. And this translates to 1.6% of the Ghanaian population. The HIV prevalence has remained around 1.6% for quite some time now. But I think that it is important to rather look at how many people are being infected now. So new infections is been going up between 2010 and 2016. That's about almost 2 years ago. It had risen by 21%.
Wow.
Across all ages. But the proportion is more significant among the youth between 15 and 24 years. That was 45%.
Okay.
New infections rose in young people by 45% within that period that I mentioned. And so that is a concern, because when you see new infections going up, it means people are not adhering to the prevention messages we are giving. It also means that we have not been able to cover the critical mass of people living with HIV with antiretroviral treatment. Because when people are on treatment and they adhere to treatment, within 6 to 12 months, they should be virally suppressed. That means HIV transmission will be significantly reduced, because a virally suppressed person can hardly transmit the virus to another person.
What are you saying? For somebody in that category, you still can have unprotected sex and not infect the next person? Is that it? We
do not encourage people living with HIV to have unprotected sex. But science has proven that 96% chance of not transmitting the virus. And so, of course, there is some marginal probability that he can. Okay. And therefore, we continue to encourage them to use condom at all times.
So this door-to-door service that you're providing now, it has started, but is it a continuous program?
Yes, it's a continuous program, but it's targeted, because as you know, most Ghanaians, about 98% of Ghanaians don't have HIV. And so you want to target the population segment that has that is more at risk.
Okay, so such as?
Otherwise, it's quite expensive, doing HIV tests. It's quite expensive, and as a resource-limited country, we have to be prudent with the limited resources we have. Okay. So it is more targeted.
Okay, so now, which areas?
So we are targeting men.
You're targeting men?
We are targeting men at this moment, and we want to, test men and women in uniforms, males in the middle class. We want to go to workplaces to test. And here again, we target events and locations. So events like the festivals that are held across the country every year.
Were you at the Ghana Music Awards? It was just a couple of weeks ago.
Yes, we do target all those events. And you know, events that bring large numbers of people together, like the Joy FM.
The Y2K party.
Yes, Family in the Park, the old school reunion. You know, these are things that media can partner Ghanaians Commission, you know, in ensuring that more and more people get tested. So we are doing things like this. And we also encourage that one of the things we are doing, which is very important, is that only people who have HIV can transmit the virus to others. And so when a person is tested, we encourage, when a person tests positive, we encourage that person to notify his or her partner or partners. And if the person has children, we also encourage them to, you know, notify them and bring them for testing.
But for those who would find your officers enter their homes with your door-to-door, what should they look out for?
Yes, we usually go in a team. We have healthcare professionals like nurses who would do the test, so they do it professionally. And in such an environment, you want to ensure privacy and confidentiality. So we make sure that all the test is done in a strictly private and confidential environment and manner. And we usually will start by educating the household to make them aware, to understand the issues about HIV and the importance of knowing one's HIV status. And so once they come to your house, please welcome them. It is for a good purpose. We want everybody who has HIV to know their status, because there are several hundreds and thousands of people walking around in this country who have the virus but do not know they have it.
But have you had instances where your men have been turned away?
Men,
I think you've entered somebody's house and they've said, we don't need your services.
Yes, and it happens. And so we have made provision for that. If people turn us away, we have another way of following up. We have mobile team who will follow up and talk to the people, the person.
But testing for HIV is voluntary. I offer to do it.
Yes.
Why are you suddenly chasing me in my home? That's my privacy.
It is important because, as I said, we have to test 90% of Ghanaians living with HIV by 2020 so that we can put them on life-saving antiretroviral medicines. People must not die at this day and age of antiretroviral treatment because of AIDS. It shouldn't happen. And it is our ultimate goal is to achieve the 1990 targets so that we eliminate AIDS by the year 2030. So by the year 2030, we do not want to see any Ghanaian having AIDS. Why? Because the drugs can, you know, help the person live healthy and productive life without progressing into the AIDS. You know.
How much is it costing the commission to do this? Because I want to believe that this would be expensive.
Yes.
You're going to people's homes.
Our target is to test more than 2.7 million people a year, and so I don't have the figures with me at the moment, but obviously we need HIV testing kits, we need reagents, we need staff who will do the testing, we have to support them with transportation and logistics. So when you put all that together, is quite an amount of resources.
But you have enough to continue what you've started?
It's been a challenge. It's been a challenge. One of the challenges we have had is the fact that since our World Bank grant credit ran out in 2010, we have not had sustained funding to support HIV prevention activities such as testing and counseling. And we are now working with government to set up AIDS fund. Government has set up the fund, but the fund has to be resourced. And hopefully, once that is done, we will have, sustained domestic resources for HIV program. And here again, we want to partner with the media to also help us in our fundraising efforts. We know the economy has challenges, but still people have to be healthy to be productive workers.
Absolutely.
And if we are losing, and in fact, if you look at the demographics of HIV infection in the country, it is more within the productive segment of the population. And so our workforce is seriously at risk, and any employer should consider that as an important issue for their company. And so they need to partner with Ghana AIDS Commission to ensure that we have resources to do the work.
Finally, I understand there's a research conference that's coming up. Tell us about it.
Yes, the National HIV and AIDS Research Conference will be opened on the 8th by the President, and it will end on the 11th. It's a 4-day conference, and everybody is invited to attend. We have made opportunities for all walks of life event, and so we encourage especially healthcare professionals to register and attend. They are going to receive credit points for their continuous professional development.
How does that help them?
Oh, it helps them because once you are a professional, your regulatory body expects that you continuously upgrade yourself, and the conference offers such an opportunity.
Okay.
We expected that people who will register will pay the registration fee to our account with Card Bank. Unfortunately, Card Bank does not have widespread network across the country, so many of them could not do so. So we are giving them opportunity on the 7th, although the conference starts on the 8th. On the 7th, from 9 a.m., registration will take place at the International Conference Center. So they should go and register and pay on-site. On-site registration will continue on the 8th and the subsequent days.
And it's costing?
Online registration ends today. It closes today. So after today, they will have to go to the conference center.
Okay, so two quick things.
How
much, and then give us the online address.
Yes, how much is, for young people, it is 250 cedis, and for adults is 500 cedis.
Okay.
The address is www.nacon2018.com. NACON is NHARCON. NHARCON. www.nacon2018.com.
Okay. All right. Mr. Chairman, Etwahene will leave it here. Thank you so much for your time. He's head of research, monitoring, and evaluation at the Ghana AIDS Commission.